today we gather here and I stand before you to address a spectrum of health challenges that impact every corner of the world: communicable disease, non-communicable disease, and the mental health. I know these three dimensions might be seen as distinct, but they are intricately connected. And they are connected because they actually affect the human being. And they can actually occur at the same time in that human being. So we need to timely recognize that a holistic approach to health is not just desirable, but it's imperative. To touch on communicable disease in a nutshell is, we know that, communicable disease, here we talk about malaria, TB, and HIV. We have seen a reduction in the prevalence of HIV in Kenya and in the world because of some major reforms. The HIV prevalence in Kenya has dropped to 4.9%, and because we have put some targets, you know about the 90-90-90 targets, which talked about having 90% screened for HIV, tested for HIV, 90% being on treatment, and 90% achieving what you call not remission. I have remission because I do a lot of oncology, but having undetectable disease. We, as a country, we have been able to achieve partly part of them, but very good strides. Globally, we know that HIV accounts to about 37.9% millions are living with HIV. We still have, despite all those progress that we've had, we still have about 1.7% newly infected. So we still have a lot of work to do in terms of having cases of newly infected disease. In Kenya, we have about 1.3 million adults and 139,000 children living with HIV, with about 46,000 newly infected cases. And I know that the mortalities and mobilities related to HIVs have declined. We see people living longer, but we still have a death of about 25,000 every year under HIV. Coming to malaria, I worked in Kilifi many years, and everybody asks whether KEMRI is still doing research on malaria. So we can say that malaria has declined, and because people ask, what are they doing about malaria? I think we have had a decline in malaria prevalence in Kenya, but we still have malaria encroaching in our country. So we have a reduction from 11% in 2010, now at 8% in terms of malaria prevalence in Kenya. And this is because of a number of interventions that have been put in, the long-treated insecticide nets, issues of malaria prevention in pregnancy, treatment. So then this is available to the lower level facilities. In terms of TB, I know we still have cases of untreated TB in terms of tracing TB, but we have also made strides. I think AMREF has done a lot of work in TB research. And most of the time, these diseases do not work in isolation. So you need to actually look at them, TB and HIV in totality. So in terms of communicable diseases, how do we address the challenges that come about? One is we need to strengthen disease surveillance and reporting. And this is all the way from the national to the county and the lower facilities. We need to enhance healthcare infrastructure so that we have a robust healthcare infrastructure, which is essential for managing communicable diseases effectively, including adequate health facility, medical supplies, training healthcare professionals, and also having some isolation units. We need to continue fostering international collaboration. We know that communicable diseases respect no borders, making international collaboration essential. The countries should cooperate by sharing information, expertise, resource to prevent the cross-border spreads of the disease. Our role is to continue educating the public in terms of public awareness, education campaign, safe hygiene, proper sanitation, addressing antimicrobial resistance is also something that is cropping very highly. And then last but not least is investing in research and innovation. We cannot continue saying that things are as usual. We need to invest more in research and innovation. I know we have made strides on communicable disease, but we need to continue fostering continuous research and innovation in areas of communicable disease. Coming to non-communicable disease, that is NCDs, which is my area of expertise, and here we talk about cancers, what we call hypertension, and diabetes. We know that these are lifestyle disease, so we need to do a lot of modifiable factors in terms of lifestyle modifications, and this encompasses continuous health education to whenever patients come in, that we need to incorporate health education. Early detection and screening is very key, and this should be done even for a patient who's coming for a normal medical condition, that we should always preach about early detection and screening, making sure that our facilities are able to do screenings, and not, if possible, on a daily basis, assigning clinicians to be able to screen patients for cancers, for hypertension, and all the patients that come in should have their blood pressures taken, the sugars taken, so that we're able to pick early, their BMIs done, nutrition counseling, so that we treat patients in a holistic manner. Empowering our primary health care is very important. Healthy environment, so that we create an environment that promotes physical activity and provide access to fresh, nutritious food. And I think research, collaboration, and partnership cuts across all the areas of non-communicable, communicable, and also the mental health that I'm going to talk about. And then we need to do advocacy and policy reforms. Advocacy can drive policy change. We must advocate for policy that prioritizes health, promote equitable access to care, and support research and innovation. So I think the bottom of all this, the cornerstone of all addressing these challenges, is engaging in more research and coming up with more innovative ways of handling that, which are actually tailored towards our needs in the society. Coming to the mental health, I know it has some immense significance, shrouded in silence and stigma. Mental health is, after the COVID pandemic, I think mental health issues, which were initially stigmatized, have now come out very openly. So our body requires attention, and so is our mind too, deserves the same level of consideration. In a world marked by rapid changes, a lot of stressors, and mental health has emerged as a critical cornerstone to our overall well-being and productivity. Mental health issues shows no boundaries. They affect people from all the walks of lives. We are seeing clinicians affected by mental health. We are seeing our governors, our parliamentarians. So it affects our young communities. So it affects all walks of lives, regardless of the age, the gender, or background. Whether it's stress of daily life, the weight of expectations, or the impact of the traumatic experience, mental health challenges are an integral part of the human experience. But it's our response to these challenges that truly defines our society. So we need to break the stigma. The first step towards addressing the mental health is breaking the stigma surrounding it. Just as we could judge someone with a physical ailment, we must extend the same compassion to those grappling with mental health issues. And this calls for actions in terms of education and awareness, and be able to access the services of mental health. They should be accessible, available, regardless of their socioeconomic status. So we must make sure that we incorporate mental health services in our facilities, in our workplace. Community support, crisis intervention, policy reforms are very key in addressing mental health. The same thing that we've talked about, technology and innovation. Just like the way we're able to do Zoom during the pandemic, so for places where you're not able to access mental health services directly, then people should be able to have services offered through intervention. Lastly, before I conclude, is we need a call to collaborative action. We need to work together. We need to understand that communicable disease, non-communicable disease, and the mental health are things that can affect one human being at the same time, and we need to address them in a holistic manner. As I conclude my parting shot, a healthy society is not only that merely treats illness, it's a society that nourishes physical, mental, and emotional well-being. Communicable disease, non-communicable disease, and mental health are not isolated concerns. They are threads that are woven into the fabric of human experience. By embracing a holistic approach, we pave the way for a brighter, healthier future that encompasses the entire human health and happiness. Thank you.